It's the Metro on WDET. I'm Robin Vincent. It's been said that all politics is local. But these days, local politics can often feel very national. That's true in St. Clair County, where the medical director has been styling himself after RFK Jr., the U.S. Secretary of Health and Human Services. Since joining St. Clair County's Public Health Department in 2023, Dr. Remington Nevin has made stances against fluoride in drinking water. He's been more lenient on childhood vaccinations, and he's declared solar farms a possible public health threat. Eli Newman is a health reporter for Bridge, Michigan. He's been covering Dr. Remington Nevin and the public health changes that have been shaping out in St. Clair County. Eli, welcome to the Metro.
Glad to be on, Robin. Thank you for having me.
And I should note, we invited Dr. Nevin onto the show. He has not yet accepted our invitation. Eli, first and foremost, why did you start looking into Dr. Remington Nevin and his influence in St. Clair County?
Well, I think there was a couple of stories that we were tracking these developments on because they seem to have really fly in the face of what is generally accepted as like common medical public health practice, right? So I think first we were hearing about these actions on removing fluoride from drinking water, which of course is a naturally occurring mineral that many water supplies use to help, prevent tooth decay and all of these things that we've been using for decades, and has generally been, understood to be like pretty common sense actions that we should be taking on. So first we were hearing about that and thought that was interesting. And then we heard a little bit, there's basically various decisions that were made throughout his tenure that were interesting happening at different times, whether it be the stance about the solar farms being a public health hazard and enacting some lawsuits against that. And it also really came to a head for me where that there was essentially this defunding that was happening of these teen health centers that were put in each of these in St. Clair County's various schools. This is a very rural county, so access to healthcare is really like at a premium. And so to bridge that gap, they put a lot of these clinics in schools so people have like readily available access to things like immunizations and various other kind of healthcare. And hearing him say, hey, we actually should be defunding this or removing our oversight of this was an interesting development because, again, I think most doctors are trying to increase that kind of public health reach of their department. And he was somebody that was taking a shift against, I think, what a lot of other people do. And also was somebody who really also embodied a lot of what we're seeing on this national stage of like the the MAHA movement, Make America Healthy Again. So there was a lot of things that he notes that he was taking from that, and I just thought it was an interesting kind of microcosm of what we're seeing in our national politics, but also happening in a local way.
Okay, these are some very salient examples of how Dr. Nevin differs from what we may be used to hearing and seeing from local public health leaders. If we could, for just a moment, I want to go back to the solar farms being a health risk. Why?
Yeah, I mean, so Dr. Nevin issued a memo kind of outlining the rationale behind it, and a lot of it had to do with noise nuisance, light pollution, these kind of concepts. I think that maybe would otherwise be an aesthetic issue for a lot of these communities. I mean, again, we're talking about rural communities that a lot of the residents talk about, having, they like having these open farmlands and open spaces, and the idea of having a solar farm or also wind turbines is another big kind of sore point. Things that might be obstruct this kind of visual aesthetic have been just periodically something that residents bring up. And so he pointed to this and noted that, like, hey, there's these issues with noise pollution. This kind of can disrupt the nice pastoral quaint life that people are having, and that has a health outcome. But I thought it was also interesting that a lot in those memos he also kind of noted that, like, even if there wasn't a strong like medical rationale for any of this, it's like within his authority to kind of make these kinds of recommendations. And he would point to what happened during the pandemic and saying that, hey, there was all of these decisions that were made and nobody's had to explain those rationales. So it gets in this kind of complicated space of enacting like the will of like the local, like, politics of like what people actually want to see in their communities versus like what is like sound public health standards.
I mean, for someone who focuses on health in Michigan, Eli, does this feel unique to you to have a local public health leader coming out about something like solar farms?
Oh, I mean, 100%. I think that was another reason that I found this story so compelling. We've seen these issues crop up from time to time. Again, a lot of the COVID-19 era decisions that local health departments were making in conjunction with the CDC, that had a lot of, I think, there was a lot of friction, I think, throughout the years that we've seen with that. But he was definitely somebody that, again, who was an MD that was saying these things that felt, it definitely struck me as odd because it definitely bucks this broader trend. And when I talk to epidemiologists or other public health officials, they clearly say things that counter a lot of the recommendations that he is making.
Yeah, I mean, typically local health leaders and epidemiologists seem quite careful and calculated about what they want to speak out about for and against, especially if it's stuff that they think feels political. And it sounds like Dr. Nevin is very comfortable wading in these political waters. It has me wondering, have there been any specific policy changes that St. Clair County has enacted? Are fewer kids getting vaccinated? Has the county stopped fluoridating water?
Right. So in terms of the fluoridation, there's a standing recommendation that these municipalities should remove fluoride from the water, but that is still like in the hands of the kind of the various municipalities in St. Clair County. Keep in mind that this county is like not on the Great Lakes Water Authority like system that we all, don't have to kind of worry about these kinds of changes because they're happening en masse. But
it's just north of Macomb County, right?
Right. I would say it's like the little crook of the thumb. Port Huron being its biggest city in St. Clair County. But in terms of the actual policy shifts having, it's also hard sometimes to decouple what is maybe just a trend in the population versus some of the things that the department's doing in terms of vaccination rates. But what we have seen is that over the course of the last couple of years is that the local health department is administering less vaccines over time. And I think part of that is some of these recommendations and policy shifts that Dr. Nevin has made. One of them being that just within the last couple of weeks or so, they put their vaccine exemption procedures completely online. So if you are a parent that does not want to vaccinate your children, you're able to access a website and basically get that waiver. Otherwise, in most other counties, you would have to see somebody in person, and there's an education session that is required by state law to do that, and so St. Clair County has really expedited that. So I think that is a very much like a tangible change that he has overseen that has helped people that do not want to vaccinate not vaccinate.
So Dr. Nevin is having quite an influence in St. Clair County, and he is not the health officer. I mean, for example, I was just speaking with Oakland County's health officer, Kate Guzman, and so a medical director would answer to her. And so what we're seeing here, though, is that Dr. Nevin is having some impact. I mean, several months ago, he was at a county GOP meeting, and he was discussing the teen health center that you mentioned at Port Huron High School. Here he is talking about that.
We know that the state health department is full of degenerates. It's full of people that are using public health and these state clinics to advance a very degenerate agenda. It's evil. What's taking place is evil.
It's full of degenerates, Dr. Nevin says. So he's concerned about the Teen Health Center because it exposes young people to transgender identity, to queerness, and to emergency contraceptives. The center appears to be winding down now because of the medical director's advocacy. Why does Dr. Nevin believe the health clinic in question is, again, full of degenerates and that it is evil?
Yeah, on that front, I think that there is kind of an ideological divide between, that is fomenting this issue. So again, for what you said, that there are these, there was pamphlets that informed students about what like Plan B is, for instance, and I think there was a lot of consternation that local county commissioners had about that. Specifically, one county commissioner, Carrie Ange, she talked about this experience with her daughter and having to interface with all this and how distressing it was for her. And going to this point about the difference between like a medical director and a health officer. Health officer is, the administrator of what a health department is, and the medical director gives clinical guidance about, how these clinics are supposed to operate as a clinical thing. So a lot of the thing is that Dr. Nevin would issues a lot of like memos that get interpreted by the county commission, who are then able to enact these kinds of change on a more of like an administrative legal way, and withholding funding, ending contracts, things like that. So they're kind of listening to him in a lot of these regards, so he's able to kind of bypass this structure that I think that you're speaking to. That
Elizabeth King, who is the health officer, he's essentially able to go around her.
I would say so. Like again, she still very much is in charge of the health department. She's been there for many years, and I think she's got a lot of people in her corner at the health department. But again, because there's so many different ways that you can affect these policy changes, Dr. Nevin is working a lot of different angles in that regard and is able to get some of this agenda passed because, again, there's a political willpower to see through the things that he's advocating for.
It's the Metro on WDET. I'm Robin Vincent. My guest is Eli Newman. He's a health reporter for Bridge, Michigan. We're discussing his reporting on Dr. Remington Nevin, the medical director for St. Clair County. Now, Dr. Nevin, again, he's known as the RFK Jr. of St. Clair County. Eli, I'm wondering, does he embrace that title?
I would say so. I asked him directly about it. Yeah, and I think he sees somebody, this is a person that I think he views as somebody who has kind of bucked the kind of the industry standards to uplift some of these political voices. I think it's also interesting just to look at Dr. Nevin's just general outlook on what the role of a medical director is, and that he also believes that it should be a position that is elected, right? So he very much feels that his role is not necessarily always just to follow just like what the outstanding guidance is, but also to pair that with what the political will is of the communities that he's representing. And so I think he sees RFK, who's now leading the U.S. Health Department, as being this person that is doing this thing that is bucking the trend, and definitely somebody that he models himself after.
I want to talk about the positive aspects of the Make America Healthy Again movement before we close things out. But very quickly, before we get into that, I'm guessing from what you're saying that county commissioners are in alignment politically with this man, with Dr. Nevin, and more broadly than with RFK Jr. and his politics. Is that what you've gathered from your reporting?
I would say so. I mean, I think like all legislative bodies, there's a mix of political will. I would say there's maybe a majority of people on the St. Clair County Commission that feels in line with them. But at the same token, there was also an effort recently to merge these roles of the medical director and the health officer. We haven't really seen that gain steam because I think that there has been some reservations that some of these commissioners are having. So there are still like checks and balances. I mean, I don't think we can say that he has full autonomy at this point. But these are things that are actively being fought over.
Last 30 seconds that we have here, I mentioned there are positive aspects to the MAHA, Make America Healthy Again movement. I mean, things like people having access to healthy foods or having access to the outdoors and encouraging exercise. Is Dr. Nevin implementing any kinds of policies that are aligned with these ideals of a healthier lifestyle?
It's funny that you say that. Nothing that I've seen really like indicates that they're following again at these more like beneficial kind of postures of the MAHA movement. Again, a lot of these have been. A lot of his focus has been on the current county administration of a lot of these things, so I haven't seen that bear through.
Eli Newman is a health reporter for Bridge, Michigan. Eli, thanks for joining me here on the Metro.
Thanks for having me on, Robin.
This is WDET-FM, Detroit Public Radio, your connection to news, music, and conversation. And this is the Metro. We'll be right back after the news from NPR and WDET. Stay with us.